Thanks for tuning in to this episode of HealthCare.gov How To. My name is Janine Scholander, and I'm joined by Amy Coben. We are Outreach and Education Coordinators for the Oregon Health Insurance Marketplace. Our primary goal is to help Oregonians find their best affordable health insurance option and take advantage of all the great included benefits. Today, we will be talking about health coverage and financial assistance options available to enrolled members of federally recognized tribes and Alaskan Natives.
You may qualify for special provisions under the Affordable Care Act to help save both your tribe and you money if you are an enrolled tribal member of a federally recognized tribe, band, or pueblo, or an Alaska Native Claims Settlement Act shareholder. We have 9 federally recognized tribes in Oregon, but you may be enrolled in a tribe based in another state to qualify as well.
You may be already seeking care from one of the health services available to tribal members, such as Indian Health Services, Urban Indian Health Programs, and tribal health clinics and programs. These programs can cover a wide variety of services, but you may need care that the programs can't provide.
Anytime during the year, you can buy a private insurance plan that will cover care you get at your tribal clinic or care from other providers. If you qualify, financial assistance lowers the cost of your plan and allows you to pay nothing for covered services when you get care from your tribal clinic or from another provider. This means you can keep your same Indian Health Network provider while also having access to a wide variety of other services that your clinic may not offer. In addition, your health insurance will save the tribe money by paying for services you may already be taking advantage of. You can also change your plan anytime throughout the year, up to once per month.
Financial assistance is only available through the marketplace and is available on a sliding scale. The lower your income, the more assistance you may qualify for. There are 2 different types of financial assistance through the marketplace: premium tax credits and cost-sharing reductions. These type of assistance are available in addition to any premium assistance that may be available through your tribe.
When you fill out an application, the system will calculate what is considered to be an affordable premium based on the information you enter. It then compares this amount to the cost of the second lowest cost silver plan in your area. If the second lowest cost silver plan is more expensive than what is considered affordable for you, it subtracts the 2 to determine how much in premium tax credits you qualify for. You can use those tax credits on any plan available to you through the marketplace. If you choose a plan with a lower premium, you will pay less for the premium, but other out-of-pocket costs may be more expensive. If you choose a plan with a higher premium, you will pay more for the premium, but other out-of-pocket costs may cost less.
Premium tax credits can be applied to the premium throughout the year or claimed at the end of the year on your taxes. These tax credits are always reconciled at the end of the year, so it is important to update the marketplace if you have any changes that could affect your eligibility, such as income, address, or family. If you end up making more money throughout the year but you do not report the increase to your income, you may have to pay back some of the credits you used throughout the year. The IRS will add this to any additional tax you owe or take it out of any refund amount. However, if your income ends up being lower throughout the year than you estimated on your application, you may get more tax credits back. You will not receive a separate check for any additional tax credits that you are owed. It will be added to the refund or taken out of any other tax payment you have due.
The second type of financial assistance is called cost-sharing reductions. If you are an enrolled tribal member or an ANCSA shareholder and qualify for these reductions, you will have 0 cost sharing on any plan purchased through the marketplace. Your household income must be below 300% of the federal poverty level, which is $75,300 for a household of 4 in 2019, unless you qualify for purchase or referred care through your tribe.
All plans available on HealthCare.gov must include 10 essential health benefits with no annual or lifetime limits. These benefits are really large umbrellas with many services that fall under them. Some examples are emergency services, maternity and newborn care, mental health and substance use disorder services, and prescription drug coverage.
Included in the essential health benefits are a long list of preventive services that are covered at no charge to you, even if you don't qualify for 0 cost sharing. as long as you're visiting an in-network provider. Your Indian healthcare providers are covered in-network with any plan. Preventive services are intended to keep you healthy by catching issues before they become more serious. This is a very abbreviated list, but can give you an idea of some of the covered services. Some of these services also have special caveats. For example, diet counseling may only be available to adults who are at risk for developing a chronic disease like diabetes. You should work with your doctor to determine which screening tests or services you may need. And remember, it's a screening when you are healthy. It will be covered at a different level if it's a test to diagnose an illness you already have symptoms for. That's another reason to work closely with your provider when you seek preventive care.
If your tribal provider orders a specialized test or procedure and you do not have insurance, it can cost the tribe a considerable amount. In addition, it is important to consider what charges you may face if you are in an accident and must seek emergency services. Billing the insurance not only saves you money, it can help the tribal dollars as well. If you enroll in a private health insurance, you will have coverage for additional services that your tribe's clinic may not offer, such as MRI, an emergency room visit, or surgery.
Another benefit of enrolling in private health insurance is that your plan will help pay for covered services at your tribal clinic. This means that the insurance companies may compensate your clinic for the cost of services that were rendered. This allows the tribes more money to spend on other services and programs.
When you submit an application on HealthCare.gov, you will be asked questions to report your status as an enrolled tribal member or ANCSA shareholder. The first question will give you the opportunity to select who is in your household has Native American or Alaska Native status. The next question will further clarify if that household member is an enrolled member of a federally recognized tribe or Alaska Native. The application will then ask what state your tribe is based out of, and give you the option to select from the list of federally recognized tribes in that state. The final screen will have you confirm that the information showing is correct.
When you complete your application on HealthCare.gov, you will need to report any income and/or deductions that you also report on your taxes. If you receive income that is non-taxable, such as trust income and resources, you do not need to report this on your HealthCare.gov application. However, any income that is taxable, such as per capita income derived from gaming, should be reported on your application. The goal is to have your application match your tax return as closely as possible. And don't forget to report any changes to your income or deductions throughout the year to ensure you're receiving the correct amount of financial assistance.
Typically, a special enrollment period is only available if you experience a qualifying life event mid-year, such as moving, loss of job, or marriage. However, an enrolled tribal member or Alaska Native, you have an ongoing special enrollment period. This means that you can enroll in coverage, change your plan, or cancel coverage anytime throughout the year, even up to once per month. Keep in mind that if you enroll in or change your plan after the 15th of the month, your current plan will cancel at the end of the month, or your new plan will be delayed for 1 month, so you will have a 1-month-long gap in coverage.
If not everyone in your family is an enrolled tribal member, you can still take advantage of the great savings on out-of-pocket costs while your family is enrolled in coverage with the savings available to non-tribal members. Everyone in your family can also take advantage of the same special enrollment period if you submit one application for your entire household. Keep in mind that any non-tribal members must enroll in their own plan if you'd like to take advantage of the extra out-of-pocket savings available to you as an enrolled tribal member.
Once you submit your application to HealthCare.gov, it is important to check whether you need to submit any documentation to show that you are an enrolled tribal member of a federally recognized tribe. Examples of this document that you can submit are the enrollment card, certification of degree of Indian blood, census document, or a document from the tribe stating your status with the tribe. You can submit the documents via postal mail or by uploading on HealthCare.gov. The most efficient way to submit your documents is by uploading on the website.
Here at the Oregon Health Insurance Marketplace, we have a dedicated team member to help with tribal questions, relations, and consumer issues. Marina is here to help if you have any questions or things you seem to be going differently than you'd expect.
Thank you for watching this video. We hope it clears up your questions about health coverage and special provisions for the tribal community. Visit our YouTube channel for more helpful videos and check out HealthCare.gov for more information and to find local assistance.